Next speaker is Dr. Natasha Radhakrishnan, talking on psychosocial challenges and the unseen burden in pediatric uveitis.
Good morning to all. My topic is Psychosocial Challenges, the Unseen Burden in Pediatric Uveitis, a quantitative and qualitative study. So pediatric uveitis, you know, has late presentation and chronic relapsing course, and it is potentially sight-threatening. The clinical aspect always comes under the scope when they come to us, but the psychosocial impact is often neglected. Pediatric age, there is significant morbidity and higher disability-associated life years in these children. So the psychosocial impact comes as an affected functional vision, complicated regimens, complications of the disease itself, compliance issues because they lose school days, and financial aspects of the disease and the chronic course of the disease. So the methodology, the aims were to evaluate the impact of pediatric uveitis on quality of life of these children and their parents, to identify factors that affect the psychosocial impact and quality of life, like age, gender of the child, duration of treatment, and surgical interventions. It was a cross-sectional observational study. 50 children between the ages of 6 to 16 with pediatric uveitis who have a follow-up with us of more than 6 months were enrolled over a period of 6 months in October 2023 to March 2024. The assessment was carried out by administering these standardized scales: the quality of life with the PED-QL questionnaire, functional vision and eye-related quality of life with the PED-IQ questionnaire, and the caregiver burden using the Zarit burden interview for parents. All questionnaires were converted to Malayalam for those not well-versed in English and validated by back translation. All were administered in the form of personal interview by a single observer. The PEDS-QL questionnaire is divided into 4 parts: physical functioning, emotional functioning, social functioning, and school functioning. And for ease of interpretability, the items are reverse scored and then a score is given. In the PED-IQ questionnaire, again, there are 4 parts: functional vision, bothered by vision, social impact, and frustration components. And the higher score indicates better quality of life. For each patient, the RASH scores were calculated for each distinct domain by age group using previously published RASH lookup tables. This was done to increase the ease of interpretability. Zarit burden interview was administered to identify psychosocial impact on the parents of affected children and comprised of 22 items on a Likert type scale. Higher scores indicate more caregiver burden, and the patients were categorized on the basis of the burden score from less than 20 to more than 60, indicating severe burden. The statistical analysis, descriptive statistics were used to summarize the different variable studies and characteristics of subjects. Quantitative variables were expressed in terms of mean and median, categorical as numbers and percentages. Parametric tests like chi-square test for normative data and non-parametric test for non-parametric data. Results: 50 patients aged 6 to 16. Mean age was 12.26. Mean age at onset was 8.56. Mean follow-up period was 9.6 months. Ratio of male to female was 24 to 26. And 11 patients had unilateral disease. 16 patients had unilateral disease and 34 patients had bilateral disease. Based on anatomical location, 30 patients had anterior uveitis and intermediate uveitis was least common. This is the baseline demographic and clinical profile of the patients. The PED-QL, there was no significant difference in scores based on gender, age of onset, laterality of the eyes, etiology, medications, or history of surgical intervention. However, school function scores were significantly less in pan-uveitis cases. Total scores had a weak correlation with younger age, better visual acuity, and shorter disease duration. PED-IQ, which is bothered by eye domain based on sex, with girls having statistically significant lower scores than boys. Functional vision was lost in children who had history of surgery and younger age group. BCVA had a weak but statistically significant correlation with all the sections, and a negative correlation with duration. Longer the duration, more the frustration level. Zarit burden interview, all parents had a score less than 20, which means little or mild stress, but we divided them with the median score into 2 difference, and a significant difference was found on basis of sex. The parents of girl children were much more worried about their disease than the parents of boy children. Discussion: with advanced treatment options, we have better maintenance of BCVA, but there is increased treatment cost, compliance and treatment issues, financial aspect of the treatment, frequent visits and loss of work days add to the burden. Assessment of the psychosocial impact is important for comprehensive management. Why did we use 3 questionnaires? Because the PED PED-QL is used in chronic diseases but is not eye specific. PED-IQ is very eye specific vision threatening diseases it can be used in, and the Zarit burden is used for parents. The existing evidence you can find, there is a normal threshold that has been done in many of the studies, and our age matched, so they have age matched controls here, and this is the score usually, and in our study we found that definitely the total score is much less compared to the normative data in all these questionnaires with normal children. The PED-IQ vision-specific quality of life was done by Leske et al. And again, all domains were less in our children compared to age-matched normals. The Zarit burden for us was much less, as in the burden was much less. This could be also because it was a personal interview, like a qualitative interview, and for that the parents may find it very difficult to come out to the fact that they are burdened by their children. So I assume there is a bit of a bias in this literature in our study. To summarize, the important factors impacting the quality of life was the younger age, better visual acuity, shorter disease duration, better quality of life, but it was weak and not statistically significant. School function with pan-uveitis, probably higher loss of school days because of the severity of the disease. And in the PED-IQ vision, in the division, it was the treatment duration that was giving the maximum correlation. The longer the treatment duration, the lesser the quality of life. And in Zarit burden, it was very strangely, even in this time, gender, because they're more worried, the parents were more worried about girl children than boy children. So to conclude, this aim to throw light on a neglected aspect in our clinical care, the psychosocial impact a chronic vision threatening disease like pediatric uveitis can have on the quality of life of the affected children and the burden of stress on the parents of these children. We hope that these findings will help us become more empathetic and understanding in dealing with these patients and their parents and become more holistic in our clinical care. These were the questionnaires that we used in our study. These are my references, and I thank you, and let us look beyond their eyes. Thank you.
Not really a question, but just a comment. I just want to know whether this you chose mostly anterior uveitis, which does not have a very long-term course or not a very high ocular morbidity.
No,
Was
ma'am.
it an intentional thing, or
No, ma'am. These are all children with juvenile idiopathic arthritis who have very high morbidity.
No, you said anterior uveitis, so
No, juvenile idiopathic arthritis, the most common manifestation is a chronic anterior uveitis, not acute anterior.
But they all have lot of vitritis and other things also, like cataracts and
Chronic anterior uveitis with complications. This was just based, I have not put in the complications. All these children have chronic pediatric uveitis with complications who have underwent surgical interventions, everything.
everything.
Minimum follow-up of 6 months. Average follow-up was 9 months.
How many were there on systemic steroids? All of them were on systemic steroids?
Initially, then most of them are on adalimumab and other immunosuppression. That is there in that baseline characteristics slide.
The Zarit scoring, was it not correlated with the type of uveitis?
Everything was correlated, sir. All the questionnaires were correlated with the type of uveitis. But
the Zarit score will be lower if you have a pan-uveitis or posterior uveitis, something like that.
But even though even pan-uveitis, posterior uveitis, actually because they were all on immunosuppression for long term, the amount of times they need to come, all of that was very similar. But somehow there was no correlation with any of that except gender when we did the multivariate, the final analysis.